with Stephen Gracie, the Executive Director of Idaho Federation of Families for Children's Mental Health. Stephen, please outline the Federation's understanding and related concerns with the Medicaid cuts in the American Care Act repeal bill, with respect to proposed changes and effects on individuals and families that are served through Medicaid-funded programs and services in Idaho.
Well, that's a pretty big question. Mostly the answer to that is certainly there's going to be problems, because we're talking about something that's going to dramatically reduce the amount of money that comes into Idaho for Medicaid, because the idea is that Medicaid, in terms of how it comes in now, would be changed into a program in which it becomes a block grant with caps on it, meaning that there'll be a set amount of money that the people that utilize Medicaid will have available to them. And once that cap is reached, the funding is not going to be there any longer unless the state, probably out of the general fund or some other fund that they may or may not have, is willing to continue and to expand the support for that particular person and group of people. It means that the cuts that are going to take place as a result of doing away with the Affordable Care Act. And the Affordable Care Act was the motivating force behind what was called the expansion of Medicaid, which meant that Medicaid services were being expanded to many, many more people. Currently, one of the things that was an issue with the Affordable Care Act was a thing called the gap. And these were people that were caught in between making too much money and not enough money in order to be eligible to take advantage of what was being offered through the Affordable Care Act. Now, that was a problem, as well as several other kinds of problems that have been noted throughout the country in terms of rising costs and so on with insurance companies. But the answer that the Congress seems to have come up with, this new bill, does a whole lot more than fix, as what people mostly are saying they want to take place with the Affordable Care Act, fix and replace with something better. Meaning what people really want is they want to see a reduction in the cost that they're paying for their premiums. They want to see a reduction potentially in the cost that they pay in terms of co-pays and so on. So Medicaid suddenly has become more of a, how can we save billions of dollars through the Medicaid program, which is going to deprive millions of families, and kids in particular. If you don't know this, kids in this country right now are essentially around 60% of the population of people that utilize Medicaid. In Idaho, it's about 70%. That's a huge percentage of the dollars. And what we're really talking about are people with disabilities and kids and older people who are going to have the brunt of this put on them if they pass this new bill in the Senate as they have it now. Now, they're rewriting something, but we don't know what it's going to be. However, the Medicaid part of this, and looking for that multiple billion-dollar transfer of dollars over the course of 10 years, is going to basically go towards tax cuts for extremely wealthy people in this country. And it's one way for them to cover that particular cost. And that's why it's in there. At the same time, they have this attitude that says Medicaid is being abused in some fashion, or people are being ripped off, or it's not worth it in some instances, in some cases. And that may very well be true in some instances and cases of people taking advantage of Medicaid if they can. But it's a pretty tough thing actually to do. The Medicaid office in Idaho is extremely efficient and utilizes the dollars that they do have to the tune of 97% going into services. That's an impressive number, like 3% going toward administrative cost. I don't know that you can do a whole lot better than that. When we go to a block grant program with caps on it, I think you'll see the Medicaid system is going to have to make some dramatic adjustments. And what we know now is that part of a thing called the Jeff D. lawsuit that took place over 30 years ago in the state of Idaho, and has gone through a series, several different kinds of opportunities for change in the way children's mental health services are provided in the state. That was what the lawsuit was about. It's about to expand and take place and be implemented into the fashion of a thing called YES, Youth Empowerment Services, which is implementation of a brand new children's mental health system throughout the state. And that's being implemented now as a result of a consent decree that was signed by the governor just 2 years ago. And as we proceed forward on this, because it's a plan that's going to take at least another 5 years for it to be fully in place with all the different community-based services and other kinds of services that people, parents, families are hoping to have available for their kids will be taking place. The problem is that part of that, a major part of that, is going to be paid for by Medicaid, the Medicaid dollars. Now, what will happen if there's a block grant and caps on those dollars? We don't know. We've been assured in many respects, and I know that the department that's trying to put the new system in place and all the work that they're doing do not feel necessarily that that block grant will have that big of an impact on the implementation of those services. However, it is a question mark because the dollars are going to have to come from somewhere, but I think that they pretty much have guaranteed that they would find those dollars one way or the other to continue the implementation. So it's important in that respect. The other parts of this that are important is to understand that people with disabilities, kids with disabilities, in our realm of the world, kids with mental disabilities who either have a mental illness or developmental disability, all these different kinds of services that help them and their families to be able to sustain them in the community are probably at risk if this change takes place in terms of the dollars for Medicaid. Some of those programs, most of them that are the community-based ones, which are generally not mandated by government, but were part of the Affordable Care Act, will probably also go away, so that states will be making choices. And as we all know, when we're talking about state budgets and we're talking about paying for things like this, that there's a lot of hesitancy, and what we need to revive in terms of the minds of people again is that Medicaid matters, that it matters for everyone, including the people that are not disabled, including the people that are not kids, including the people that are not old, like people like me, and they potentially may need the services that Medicaid offers as it currently does now. And that's pretty much why there's a big difference between the Affordable Care Act and the new bill.